I am eager to present to you the next presentation on safety in autism with two of our speakers, Jennifer Mannheim and Sydney Krebsbach. So I'm going to tell you a little bit about each of them. So Jennifer has been a pediatric nurse practitioner since 2001. Her clinical work has focused on children with neurodevelopmental disabilities. The last 14 years has been at Seattle Children's Autism Center. Jennifer's role at the Autism Center includes evaluating children and teens for autism and supporting autistic children and their families. She is also part of the University of Washington ECHO Autism Project. Sydney will be supporting her. Sydney is an autistic self-advocate. She has many hats, including the co-chair for the Washington Developmental Disabilities Council, hub team member of the University of Washington ECHO Autism Project, and she works as a SNAP, Spokane Neighborhood Action Partners, where she assists with the client intake process. Sydney has presented at conferences around the United States and received many awards and recognitions for her advocacy work. Welcome to both of you.
So yeah, Sydney and I put this presentation together, and oh, I see Carrie with the thumbs up. Hey, shout out to the Autism Center, Carrie Morales. So today we're going to be presenting on autism and safety, and I think we'll just move on to the slides here. We had a wonderful introduction. And so first, I think Sydney, they already presented her, but I'll just have Sydney say hi, and that's a picture of her.
Yes, hi. My name is Sydney Krebsbach, and I am a self-advocate with the University of Washington's ECHO Autism Orange cohort, and I'm one of the two co-chairs for the Washington State Developmental Disabilities Council. And also I work for Spokane Neighborhood Action Partners, also known as SNAP. Also, I'm an individual with autism.
Yes. And I'm Jennifer Mannheim, as they mentioned, and I'm at Seattle Children's Autism Center. And I work together with Sydney for the University of Washington Autism ECHO project. And that's how we know each other, and we work together there. And I've been a nurse practitioner for over 20 years. And this picture here is right after my daughter was born. So that was 14 years ago. So I look much better there. That's graying from raising teenagers. All right. So moving on. Our objectives today are to review the common safety challenges that autistics face, discuss tips for prevention and response when an autistic person has eloped or left without saying where they're going, to describe the impact of bullying and tips for parents, and then last but not least, identify steps nurses can take to educate autistics about their medical condition. So I'm going to turn this one over to Sydney to talk about language.
Yes, thank you, Jennifer. So language matters. People first versus identifying people first language. Identifying first language puts the disability first, and it's viewed as part of who they are, not something that's happened to them. A person's first language emphasizes the individual equity and dignity of people rather than defining people primarily by their disabilities. Persons first. I am a first person with autism. My child with autism. Identifying first. I am autistic. My autistic child. Those are the differences.
Thanks, Sydney. Yeah, this is a question we get from people often, is like what the difference between first and person identity first language. And Sydney, which do you prefer?
Honestly, I would prefer a person with autism rather than an autistic person.
All right. So there we go. And I think it's important to know that this is a preference. And today as we talk, we may switch between both identity and person first language. And that's to honor that there are different ways in which people prefer to talk about autism or their autism. So calling that out. And Also, I wanted to start this talk off by telling you why we're doing this. And we were invited after someone had seen one of our talks in January last year about keeping autistics safe. And so this is part of a Conversations About Autism series that we started in 2022, which was kind of taking off from another series that we had, which was called the Autism 200 series. And so this talk that we gave included Sydney, who's an autistic self-advocate, as well as a Seattle police officer who's been very involved in educating police on autism. He's passionate about it because he himself has a child with autism. And then we also included two parent advocates who are very involved in advocacy for their children. And one of them was of a Black family as well too. And so speaking about the intersectionality of safety, not only when you have autism, but also when you identify or when you have a different skin color. So wanted to give a shout out to that conversation. And I think it's really important to hear the power from those people speaking from their own perspective and the challenges they face. And so if you have a copy of the slides, you can go and watch that video as a supplement to what we're talking about today. And there are many other, if you go to our website, there's many other talks that we have done last year and years prior. So part one, reviewing the common safety challenges that autistics face. So I wanted to say today in preparing for this talk, I pulled resources from two excellent organizations. The first is the National Autism Association, and I have a link to their website there. And they provide a number of resources for families and schools. They have one program called Give a Voice, which provides access to communication methods for individuals with autism who are non-speaking or unreliably speaking. They also have the Big Red Safety Box program, where they ship safety boxes to families who have concerns about their child wandering or elopement, which we will talk about next. There's also the Big Red Safety Teacher Toolkit with a similar type of resources. And then last but not least, their Autism Atrium, which is a training and educational program where they offer a lot of information. And so this is a great resource there. And then we also pulled from the Autistic Self-Advocate Network, also known as ASAN. And I pulled actually quite a bit of information from their Autism Safety Toolkit. And I feel it's very important that we included this, as there is some different perspective from autistics themselves when speaking about their challenges from their own perspective, their own lived perspective. So why talk about safety? And I just want to acknowledge those listening today that this is a difficult topic to talk about for some individuals. And, you know, if you need to take a break or take some deep breaths for yourself as we talk about some of these things, I encourage you to do it, because we're going to talk about the impact, about some data that can be kind of challenging. So just kind of progression of research in 2001, there was a California research team that noted elevated deaths in autism attributed to several causes, including seizures and accidents such as suffocation and drowning. Then in 2008, a Danish researchers found that the mortality risk among the autism population is twice as high as the general population. And then in 2017, the Bureau of Justice Statistics found that people with disabilities were 2.5 times more likely to be the victims of violent crime. Especially teenagers ages 12 to 15 had the highest rate of victimization. And then they are 3 times as likely to be victims of serious crimes such as rape, robbery, aggravated assault than people without disabilities. And then in 2022, there was a meta-analysis done by a researcher in Spain that was looking at autism and ADHD and wondering kind of about, you know, many individuals with autism also have ADHD, and then there are also individuals with ADHD without autism, and looking at which of these two diagnoses were more associated with injury and mortality. And they noticed a significant increase of mortality due to unnatural causes for individuals who had both autism and ADHD. but only individuals with autism had an increased risk of mortality from natural causes, neurologic, respiratory cancer, and that type of thing. And I'm going to share with you these resources, the direct links that you can go and read more about the data. But they do talk about some of the challenges for individuals with autism is not only their autism, but other health issues like obesity, sleep impairments, seizures, things that that are often associated with autism and maybe aren't treated in the same way that those without autism are treated. So again, these are the common safety challenges we're going to address today: elopement, bullying, abuse, violence, and health education. So when we talk about elopement, part of the conversation is for many adults and children who cannot speak, attempting to leave a situation is one of the few options they have to communicate. So the question is, are they leaving a situation that's not supportive of them, or are they actually eloping, so just leaving without maybe as much of a purpose? And so often when we are talking to families who have children who are eloping, we're wondering about, could there be an underlying abuse situation? Could it be sensory overwhelming environment that they're trying to escape? Or could it even be boredom from a repetition of the same tasks over and over? So I encourage you, as you encounter families who are struggling with this, to maybe think beyond just the kid seems to be taking off for no reason, that there might be an underlying reason to that. So in 2017, the National Autism Association published a study that examined over 800 missing person cases related to autism and elopement over a 5-year period, and almost a third were fatal or required medical attention, and over a third of cases were classified as close calls. So 2/3 of cases are needing it, of the 800 were actually pretty significant. And so just some more data to kind of bring light to the seriousness of this safety issue is that roughly half of children with autism attempt to elope or leave an area without saying where they're going from a safe environment, a rate that's nearly 4 times higher than their unaffected siblings. And children with autism are 8 times more likely to elope between the ages of 7 and 10 than their typically developing siblings. And between 2009 and 2011, the accidental drownings accounted for 91% of US deaths reported in children with autism ages 14 and younger, subsequent to wandering and elopement. So basically, those children that did elope during that time, the most common cause of death from elopement was drowning. And then more than 1/3 of autistic children who wander or elope are never or rarely able to communicate their names, address, or phone numbers. And then wandering was ranked among the most stressful autism behaviors, and 85% of parents who had children who eloped. And 62% of families of children who elope were prevented from attending, enjoying activities outside the home due to fear of wandering. So basically, this is something that ends up really impacting not only the children, but their families, because they're not able to go out and enjoy many community activities. 40% of parents had suffered sleep disruption due to fear of elopement. And half of the families with elopers report, and I see the comments in there. I just wanted to let everyone know, in case you weren't here at the beginning, Sydney, our self-advocate, is having to join by phone because of some audio issues. And so what you hear in the background is just a shared office that Sydney has with her colleagues. So I saw the calls for muting, but we're not able to do that right now. So I appreciate the comments, but just wanted to let everybody know that's what's going on. Yeah, Robin, I hear what you're saying there about potentially muting, but I think that's it's a challenging thing to do off and on from the phone. So I appreciate that, though. So regarding elopement, half of families with elopers report that they had never received advice or guidance about elopement from a professional. And so this is where I'm bringing all of you into this conversation, that only 14% had received guidance from a pediatrician or other physician, and only 19% had received support from a psychologist or mental health professional. And so in a moment here, I'm going to go through some tips, but I wanted to say part of what makes me proud to be a nurse and a nurse practitioner, and the reason I chose this pathway, is I feel like nursing has such a strong foundation in preventative health and patient education. And so I think nurses are uniquely in a position in which we can share this kind of information and knowledge with families in order to help prevent some very severe safety issues, mortality and death. And so this, I'm not expecting anybody can read this because it's way too small with the font. But I wanted to point out that this is a sheet that is available on the National Autism Association website called Wandering Quick Tips. This, I took all the information on that little itty bitty slide and put them into a much more legible, readable form. And so on the left, you'll see here, it starts with installing home safeguards. So encouraging families to have secure locks, home security systems, a fenced yard, secure garage door openers, visual prompts like simple stop signs. And that red safety box, the big red safety box, has these big red stop signs that you can then put up on the doors as a visual prompt. And then also has these door alarms. It comes with one door alarm that you can put up at the front door. So if the door is opened, it sounds an alarm to alert you that the door has opened. And there's also, you know, fenced yards and things. I know there is some cost associated with a lot of these kinds of accommodations. And there is something called the BENS Fund, BEN''S-FUND. And that is a $1,000 grant families can apply for every year to help cover any services or things such as fenced yards and home security systems to keep their kids safe. And I know the mom who started the BENS Fund, she's actually in that talk that I mentioned at the beginning here about safety. Her son is Ben, and she is the wife of the Seahawks general manager. And so this is a fund that they use to support families. And so that's a means that you could do that. Yes, I will definitely put the BENS Fund information in the chat. And then personal safety guards, things such as the ID bracelets, temporary tattoos, eye tags, or other kinds of GPS locator type equipment. And then I have a lot of families where they say, well, my kid would never wear an ID bracelet or any of those kinds of things due to sensory issues. And so I've even encouraged them to put the parent name and phone number like in their shoe or other article of clothing, with the idea that if they got separated and were lost, there could be somebody who could help them reunite. Yes, thank you, Autumn, for putting the BENS Fund link in the chat. There's also, we encourage families to create community awareness. So introducing your child to trusted neighbors, filling out an alert from a local police, which I'll go through in a moment, including a current photo, and then alerting school and bus driver that this is a concern. Remaining hyper vigilant. And by that, we would also mean, you know, if you are out and about with your child, making sure, you know, if others are around, that one person is always in charge of making sure where the child is, or that way it's so easy to kind of lose track of, oh yeah, so-and-so's watching them, but making it a point that somebody's keeping visual contact of that person. Identifying triggers and teaching self-help. So this is another really important thing to think about, is teaching alternative ways when a child or young adult or adult with autism is feeling overwhelmed, that they might be able to respond to that stimuli. So examples would be like use of a headphone. There's also some families request disabled parking permits for their individual with autism who elopes and is barely safe in parking lots, unsafe in parking lots. So that's something you could have a medical provider complete a disabled parking permit for under the category of neurologic condition. Also, we really encourage teaching safety skills, and I'll talk about that at the end, sharing some resources about swim lessons and also some social stories about safety, and then calling 911. So if a child or adult goes missing and you're not sure where they are, we do encourage calling 911 right away, and calling the National Center for Missing and Exploited Children, or encouraging them to call them. And if that's the case, you've activated the 911, encouraging first responders to search water first. And that goes back to the statistic of concern for drowning. You would also want to check the highest areas, like busy streets, train tracks, parked cars. That's a common one. A lot of our kids will go into a car that they find open and hang out in there, and everyone's searching, and they're nice and safe in the car, but we just don't know where they are. And also places that they like to go. So, you know, if McDonald's is a favorite place, that would be a great place to go and check early on. All right, part 3. I'm going to turn this one over to Sydney. Sydney, do you want to unmute and take on this part here? There you go.
Yeah, thank you, Jennifer. So, about bullying. Bullying is a behavior that hurts, harms, or humiliates, whether physically or emotionally. It can happen while at school, in the community, or online. Those bullies often have more social or physical power, while those targeted have difficulty stopping the behavior. The behavior is often done with intent and typically repeated. Reason why bullying is more common in autism: difficulty with social interactions, keeping a conversation going, challenges with social communications, reading social cues, struggles with peers, relationships, hard times making and keeping friends, engage in atypical behaviors, repetitive movements, struggles with things are unexpected, and sensory triggers. So here is the data for risk for victimizations in students with ASD, while 2.4 times higher than that's for typical developing students. So estimate shows that in 6th and 12th graders are more likely to be bullied while on the autism spectrum.
Yeah, Sydney, so I think, yeah, here's where we were going to maybe this is a good spot, Sydney, where I can ask you a little bit about your experience with bullying. Does that make sense?
Yes, that makes sense.
Yeah, so Sydney, I think we were going to talk about it later, but I think it's a good spot to do it now. So were you bullied in school, Sydney?
I wasn't bullied in school, but I was cyberbullied when I was 27 years old.
Gosh, you want to tell us a little bit about that?
Yes. This all started when I wanted to be a police officer for Halloween in 2020. I posted it on Facebook, and a girl who I used to work with in the Alaska State Legislature made horrible comments about me. She even called me a racist. And so when I told my parents about it, they didn't believe me. But when I told my older sister about it, she went into protective mode and told everybody about it.
That's awesome. So your sister came to your defense.
Yes, that's correct.
Great. Thank you, Sydney, for sharing about that. I know you were somewhat lucky to not experiencing it so much during this time frame, but you definitely received that later on from peers, which sounds like that was probably some of the hardest part, people you knew.
Yeah, it was. It was difficult from someone that I knew who was at first sweet and nice to me, and then she turned against me. This was a period during COVID and during the Black Lives Matters movement.
Yeah, that's really tough. Thanks for sharing that, Sydney. I think I was going to take over here. Did you want to talk about this one too?
Yeah, I can talk about this part too. So regarding victimizations, students with ASD experience verbal, relational, physical, and cyber victimizations of bullying.
Yeah, so you can speak to the cyber victimization for sure.
Yeah.
Excellent. And so for those of you who are interested, all of this information was pulled from this article at the bottom here. So I think I was going to talk about this part, Sydney.
Yes. Here are some.
All right, Sydney, I think I'll start this one here.
Okay.
Yeah, so this was pulled from PACERS, which is the National Bullying Prevention Center. I encourage all of you, if you have families who are struggling with their child being bullied, or if you work with adult autistic or autistic adults, sorry, that you can refer to this resource as well too. But it includes sample letters that you could guide families towards that give them the language to notify the school about the bullying incident. So this template here helps families kind of organize and figure out how to communicate. And then students with disabilities and bullying, the top 5 things, or this next one is a PDF, which includes the top 5 things parents, teachers, and students should know about bullying. And some of those things include keeping in mind that there might be a number of reasons a person may not report bullying, such as they may have been told not to tell, or they might fear that telling someone might make things worse. And so I also talk to parents about preparing to talk to their child about bullying. And so being ready to think about how they're going to handle the child's questions and emotions, what their own responses will be to the child, and then encouraging the adult to be prepared to listen without judgment and providing the child with a safe place to work out their feelings and determine next steps. And then there are also some resources and ways to promote acceptance at school, including this app called Sit With Us, which is designed to promote a kinder, more inclusive school community. There's also this concept of a buddy bench, and it's a simple idea. So basically you have a bench on the playground area. So any student who feels like they need a buddy or would like to have a buddy can sit on the bench, indicating to other kids around there that this person would like to have a buddy. And so it's a way to kind of foster friendship. And then peer advocacy. So according to PACER, there are more than 50% of bullying situations stop when a peer intervenes. So basically this is other students don't like to see bullying, but they might not know what to do when it happens. And so part of peer advocacy is supporting students and speaking out on behalf of others. And so in this approach, it empowers a student to protect those targeted by bullying. This works for 2 reasons. First, students are more likely than adults to see what happened when their peers are bullied, and that peer influence is powerful. And then secondly, a student telling someone to stop bullying is much more impactful than an adult giving the same advice. And so kind of the approach towards bullying is stopping it before it happens, promoting confidence from within. So talking to kids about just because someone is making fun of you for these things, to think about the strengths that they offer and the good things about them, and then looking beyond the school. So one of the tips I often give to families when this is something that's occurring is to really to find out from the teacher who the kid seems to be getting along with at school the most, so that they can foster a relationship with this kid outside of school. And the thought behind that is when you're at the playground and you're not quite sure who to play with, and I don't know how many of you have spent time on, maybe those of you who are school nurses, but spent time on a playground, and it's brutal. And if you don't have somebody to play with and you're sitting on your own, you're a bit of a target. So the idea of helping foster relationships with some classmates outside of school, so when they're in that situation at school, they've got someone to go with and play with. And so those are some ideas there. I know there was a question about adults dealing with violent crimes. And I think I would go to the resource there, the ASAN, which I will show you at the bottom here. There's some advice there for adults as well too. But this is about violent crimes and abuse. The U.S. Department of Justice and Bureau of Justice Statistics said among people with disabilities, people with cognitive disabilities have the highest rate of serious violent crime victimization, which we spoke about. And people with disabilities are more likely to be victimized by someone they know, including family members, than people without disabilities. And the Bureau of Justice Statistics hypothesized that their data may be underreported, and some types of crimes against non-speaking or inconsistently verbal people. A non-speaking person without access to communication may be unable to report a crime committed on their own by their own parents or caregivers, and they may also leave or run away from home because they lack another way to communicate abuse. And again, these are things, if we hear about individuals eloping or leaving an area without saying where they're going, is to be thinking about the possibility of abuse. And here are also some signs of abuse. This is also, again, from the ASAN network. So new stereotypic or repetitive movements, fear of a specific person or place, attempting to alter or a sudden change in behavior around someone, avoidance of tasks they used to enjoy, new or dramatically increased self-injurious behavior, loved one starts avoiding you or other people who normally support them and doesn't explain why, repeating phrases that occurred during a painful memory, start saying bad things about themselves that they'd never said before, and they might be repeating something others have said to them, or a relative or close friend of your loved one is acting indifferent to your loved one's accomplishments, successes, or actions. So moving on to part 4 here, which is identifying steps nurses can take to educate autistics about their medical condition. And part of the reason we included this information here is Sydney also brought this up as an important topic. And so I'm going to have Sydney share some of her own experiences. But what I'm going to encourage all of you as nurses to do is to talk to your autistic patients about their diagnosis and medications. And if that's something you're not as familiar to do with, our Seattle Children's Autism Center has a patient and family education page. And one of the topics under there is talking to your child about autism. And so this is a great way to learn about how to bring up the topic. We had conversations about autism about it where families shared their own experiences, and autistic advocates themselves shared their experiences of finding out this information. We also in that section have some resources about screening for bullying and abuse. And we have information about puberty and sexuality. And so there's quite a bit of information there about sexuality, which is also something that's important to talk to your autistic patients about in arming them with the knowledge to protect themselves in those situations as well too. So now I'm going to turn to Sydney again and ask Sydney, in all of your years, has anyone ever talked to you about these kinds of things?
So I remember when I was a kid, I remember being taken to doctors and they would ask me repeated questions over and over and over again. And it was intimidating and it was grueling. And I couldn't figure out what was wrong with me. I knew I was different from everybody else.
Yes, Sydney, do you mind sharing how old you were when you were diagnosed with autism?
I was formally diagnosed when I was 8 years old.
Yeah, and did anyone ever talk to you about your autism, like any medical person?
Well, none of the doctors talked to me about it, but I remember my parents telling me about it.
Yeah. Do you remember any nurses or doctors at the hospitals ever asking you like safety concerns, like if you'd been bullied?
Just that they advised me to be careful about the people around me because not a lot of people are sweet and caring and sensitive. Some people can be taken advantage of.
Yeah, and I know that has happened to you, Sydney, right?
Right.
Yeah. And thinking about one of the questions I want to ask is how were you able to get through bullying? Like what's something you did that helped you in those situations?
Well, when I was getting bullied, one thing that helped me get through it was the support. My family, my friends and relatives and everyone in the community of Juneau were able to help me get through it. Even people who I haven't talked to in a long time, like from high school or from my past jobs, were able to help me get through it.
That's amazing, Sydney. It sounds like you have an incredible network of people who love and support you.
They do. They're all looking out for me and looking at my best interest at heart.
Yeah, that is awesome. I think here and thanks Sydney for sharing all of your personal information. I think I'm just going to go through these resources here and then open it up. I know I've seen some questions flash up, so I want to make sure we have time to do that for you to answer those questions, Sydney, or if I can help people with that information. I just wanted to, hopefully you all have these slides, but call out again the National Autism Association and the Autistic Self-Advocacy Network as excellent resources for help in screening, as well as supporting individuals who have been victimized or addressing safety issues. We also have our conversations about autism, and then the Seattle Children's Autism Center website, our patient and family education. One of the resources that we developed and is on our website is called an autism support form. This was developed with the intent that families could fill this out, and then as they presented to, say, an emergency room or urgent care or other medical facility, it's kind of a brief overview about the child's safety needs, their communication style, how to communicate with them about procedures, how they communicate pain, things that are triggering or distressful, things that are supportive, and then just an important thing to know about the person. And this was somewhat developed because I had been to the emergency room with my own child, and during our long wait there, I saw several other autistic kids coming in and out and acknowledging that they didn't really get the support they needed while they were waiting in there. And so finding some way to quickly communicate with the staff about what might be most helpful for them is where we developed this. And it is in English, Amharic, Arabic, Russian, Somali, Spanish, and Vietnamese. So this has been translated in multiple languages and is available on our website. We also have car seat options for children with challenging behavior challenges. Another big safety issue is keeping kids safe in the car. I have a number of patients who are Houdinis and have figured out how to get out of their car seat and then move around the car and even attempt to open doors or distract the driver. And so here are some ideas. And then for larger individuals, how you might go about getting some of those resources. And I often also refer to occupational therapy at times if it's beyond this list. We also have, I encourage families to reach out to Smart 911, where they can input information about their child or adult that they support. So if something does happen and they can't find them, it's a quick way for all that information to be listed. And then I will open up to questions, and this is how to contact either myself, Jennifer Mannheim, or Sydney Krebsbach. Our emails are there, and I will stop sharing and open up to questions in the group. As I saw, there were quite a few in the chat. It's quite an active chat. Actually, before we do that real quick, let's see, I've got a few more minutes here. I know this is kind of a crazy thing to do in a large group, but I'm curious if you guys are able to raise your hand just briefly, who here who's participating either identifies autistic or has a loved one with autism. And we'll just do this quick little trick. Everyone raise your hand, and we'll see kind of the impact autism has kind of across those. Yeah, like we've got several hands coming up. Amazing. Thank you guys. Lots of hearts and thumbs up. Excellent. All right, you can put your hands down if you want. You don't have to keep them up. But we can maybe start going through the chat here. Unless let's see here. I think we have until 11:20. Is that right, Mindy?
You sure do. And I do have a couple questions that I've kept track of, if I can present a couple to you. First off, Sydney, we appreciate you holding your phone the whole time. I know it wasn't the best setup, but we appreciate you coming and being candid and sharing personal experiences. I know that's not easy, and we appreciate you being open with the group. So it is definitely not going unnoticed. So just a couple of ones that I kept track of earlier in the chat. So one of them was, autism is a disorder that affects the family, relatives, and the community. Seattle Children's is a well-known organization for treating this disorder, but I wonder if Children's has any program reaching out to the community to raise awareness of this disorder and to help families dealing with the disorder effectively.
Yeah, I can maybe take that one, being a children's employee at Seattle Children's. So we do offer our conversations about autism, which has been going on monthly for many years now. Before I said it was called the Autism 200. We now have gotten much better. We've joined social media, and we have our Facebook page, our Autism Center Facebook page, where we, if people like us, we send out communication on a regular basis about resources, events, things that are going on. As far as really going into the community to, raise awareness, haven't done as many of those. Oh, I'm sorry. I hear back. Okay, I think it was just a loop there, just making sure somebody wasn't trying to contribute there. But Mindy, I think there might be a loop that's coming through on your end. Sorry. We do work with a lot of primary care providers. A lot of the work that Sydney and I are doing through Autism Echo, we're trying to really support providers in diagnosing as well as managing autism. And by managing autism, I mean like the symptoms associated with it. So some of the self-injurious behaviors, sleep issues, those kinds of things. And then also through Autism Echo, we have a number of programs where we're also working with other programs like WISE programs throughout the state, a lot of wraparound services, a lot of community mental health. We also have where we're supporting individual or providers who prescribe medications. So we have a prescriber support process through Autism Echo. You can look up Autism Echo through UW and find out all of the resources there if that's something you think one of your providers might be interested, or if you might be interested in learning more about. And we in the past have done more like through some of the other agencies pre-pandemic, where we would go out to some community events and that type of thing, but we haven't done as much since the pandemic, I'll admit. But we have connected with the Vietnamese Family Autism Advisory Board and bringing awareness in that group. So anyways, those are some of our things. If you had some ideas of other things we might do, let us know. Certainly you can reach out to me if you think there's a group that might benefit from some information. We certainly reach out to schools and or if schools that reach out to us, I guess, I don't know, we've been proactively reaching out to them and providing information. I've certainly give some talks at schools and stuff like that. So.
And then another question that came through early on was, can you talk briefly about children with autism who are nonverbal and sensory seeking behaviors involving self-harm, such as headbutting or banging?
Yeah, so those are can be really challenging behaviors to understand and support. So understanding why they're doing that self-injurious behavior. If they have some sort of pain, could it be tooth pain? Could it be headaches? Could it be sensory overload? And so each kid is so individual. It's hard to give one explanation or one definitive approach. But often when those kinds of situations present to me, I'm thinking about, could there be some pain, underlying pain? I'm wondering about need for communication. If they have some sort of like communication device or picture exchange, that's where they have like different cards they can use to communicate. Like how can we support them in communicating what's going on and why they're doing that? Could it be a sensory seeking type of thing? There's some sort of input they're getting, and can we help them learn other ways to get that sensory input without harming themselves? But yeah, it's a pretty complex situation. Sydney, I don't know if you have anything else to add to that.
Yes, I do. So basically, it can be tough for anybody on the autism spectrum to get resources around town. I remember after I was diagnosed, we had to get full-on services in order for me to get the best services in Alaska. Like, for instance, I had to have a tutor to help me with my homework through Reach, And that helped out a lot because she helped me from 3rd grade all the way to 12th grade, and I was able to graduate from high school with honors.
That is awesome, Sydney. So yeah, often families are having to reach out and find resources to support, and those are hard to find, especially in Alaska, but also even in Washington. I don't know. Did we answer that question, Mindy?
I believe so. Yes, I would say.
Okay.
And I did have another one that came through from Jessica, and she may need to chime in and clarify. But it read, how about when you have a student that is in the orange category and seems to have trouble understanding that they are causing harm, as they see only that their friends think it is cool?
I think Jessica might be thinking about that research study about autistic individuals who might be perpetrators of bullying. So in that graph, we had the blue bar were victims of bullying, and then the orange were those who were perpetrating. So they were the ones bullying. And then the gray was actually those who are both perpetrators and victims. And there's kind of some theories about that as well, too. So Jessica, I think one place to start is thinking about social stories. And there's more information about that on the Seattle Children's Autism Center patient education website under social stories. And social stories was a concept that was was started by Carol Gray, who is a speech language pathologist many years ago. And the idea is using visual pictures and stories to talk about bullying. And so not only when you are bullied, but then also the impact that has on others when you are bullying. And so it's a challenging one. So that might be one place to start. But then also working with like a counselor or a behavioralist who can work to help teach a student other ways to engage peers that's not harmful. So I find often they just want to be liked and they want to engage, and they're not quite sure how to do it other than things that are getting them in trouble. And so helping them understand other ways to do that. And sometimes it's peers around who are reinforcing that. They think it's funny, and then they get the attention, and then they keep doing it. So even just helping them find maybe a peer who would be more supportive, and trying to change some of that situation. If there's no easy answer, I did want to say there's no just do this and it gets better. But social stories, working on social skills, such as ways to initiate and sustain interactions that aren't causing harm to a peer. So both of those. And the social stories is also helping them understand the impact it has on the peer, which can be hard. But that would be my. Sydney, do you have anything else to add to that one?
Just that when you take them to a doctor, if they're about to be fully autism, just to make sure that you educate them afterwards, because they might not know what autism is. Not even a kid won't understand what autism is.
Excellent point, Sydney. And so I know sometimes even, when I diagnose kids, sometimes they're really young, they're like 2 and 3. And so that conversation doesn't necessarily happen at that young age. So even as they get older, they may not know that they have a diagnosis of autism. And part of the power of knowing that is that understanding that peer interactions might feel different for them than they do for their peers. And so helping them understand that difference in they might need to learn different ways to help with the peer interaction. We're also very thoughtful about the fact that autism is viewed in a very different way now than maybe 20, 30 years ago. And so we come at it with an approach that's called neurodiversity, or neurodivergent or neurodiverse affirming. in which we acknowledge that just because they have autism or ADHD or their brain is different, it doesn't mean it's a disorder. In the sense that it is autism spectrum disorder, but it's not wrong, that there's not bad, that their brain isn't not functioning, it just works differently. And so helping them understand that in social situations, their brain maybe works a little differently. And so they might need to learn some other ways to engage friends so that those interactions are successful, as opposed to getting them into trouble. So helping them understand that there are awesome parts to their brain, but sometimes too, they might have to learn some other ways to navigate those social situations so that they get the outcome they're looking for, which is to have a friend in many cases. Did I say that right, Sydney?
Yeah, you said that right.
Good. Okay. Gotta check in. Sydney's here to keep me on track and make sure I'm saying things correctly. Mindy, were there other questions in there? I can see lots of stuff.
Yeah, a lot more is coming through. There was another one that came through. Oops. If a child with autism takes off or adamantly refuses to enter doctors' offices but needs a health-related care plan each year signed by a healthcare provider, how would you recommend supporting the family or navigating the legal requirements for schools that have care plans with a life-threatening condition?
You know, that is a really tough it's a tough situation. I will say I have absolutely met families in parking lots, in the car, with the engine going, and done the best I can do to fill out whatever forms and to get things done that way. I think it's really reaching out and communicating, and this is where I think actually nurses are some of the best advocates for a lot of our patients. I all the time get messages from our nurses about, the doctor wants a fasting lipid profile and mom can't get the kid out the door to get the blood test without food, and it becomes violent. They become violent with, in these situations. And so really, coordinating with the other people involved is like, how important is this? What can we do to problem solve this? And our nurses have always been excellent advocates. And so potentially talking with a provider who might be willing, if you set up the time and they understand it's going to take place in the car, in the parking lot, or those kinds of things would definitely be, again, I don't have one simple answer. If I did, I would be a millionaire because I would have figured out how to do all this well. But each case I think is really unique. Even sometimes at the main hospital, like I've met kids down at the fish tank down in where the food, like in the cafeteria area, and had our visit there. I mean, it's not necessarily the most HIPAA friendly, but you can get a lot done in those kinds of situations. So I think it's working with that provider and just outlining the concerns and making accommodations. And I think most providers are willing to do that. But it does take extra work and coordination. Sydney, was there anything you wanted to add to that?
Just the only thing I have is to educate them on safety, because you should be taught like stranger danger, like don't get in a car with a stranger or don't talk to strangers. And also it's very vulnerable for people with autism to learn about the safeties in the world because you don't know what's going on around them.
Definitely. Thanks. I saw there was one in there that asked to have my email, so I put my email in the chat. Hopefully that came up there. But Mindy, was another, there's so many questions in here. I'm trying to read through all of them. Were there other ones that came up? We've got another 5 minutes.
If you see one that you want to answer, you're more than welcome to go ahead. I'm trying to keep up with them myself. It's wonderful that everybody's asking so many questions.
I know there was one in here, and some of them I know might be sent to me privately, but I think they're questions that everybody asks. And one of it is about having a diagnostic evaluation. And as Sydney was saying, there's limited resources for intervention, and there's limited resources, I'd say, as well for evaluations, and that there are often some long waits for those evaluations. We do on the Seattle Children's Autism Center website, and sorry, I know I refer to this all the time, but I have worked so hard on that website, putting information on there because these are such common questions I get. Under multiple different pages, especially our treatments and services, one of the very first things, it says we do diagnostic evaluations. Yes, we have long wait lists. And there's a list of what are called COEs, so that's a Center of Excellence. So that is a designation from the Healthcare Authority from Washington State. So individuals who have, or providers who have completed the Centers of Excellence in Autism training, then get the Center of Excellence of Autism designation. And they have to, part of that agreement is that they will see individuals with Medicaid as well as, private insurance. But that list is huge, and it includes every single county within Washington State. And so I am often encouraging families to reach out to individuals on that list and see what their weight might be while they're on weights, lists for other clinics and that kind of thing. I think sometimes Seattle Children's is, well respected in most cases within the community. I think, we certainly aren't perfect, but so families feel like they have to go to Seattle Children's to get a diagnosis, and that is not the case at all. Once they have a diagnosis of autism, if they would like to receive services at Seattle Children's, we actually have a new process where we have a class that we teach called ATLAS, ATLAS, stands for like Accessing Learning Treatment Services. And basically, it's a 90-minute class that I teach on Monday evenings that talks about how to navigate services, both in the community and at the Autism Center. And then after that class, families are then able to sign up for any of our services or classes, other classes. We have a total of 15 classes we run every month that talks about various topics like school, resources, toileting, sleep, anxiety. I mean, every topic, there's a lot of not every topic, but many topics. And so, even if they've gotten the diagnosis somewhere else, they can still come to Seattle Children's and find out about what we offer and decide if it's a good fit for them, right? So if they're living in Juneau, Alaska, they may not decide they want treatment at the Autism Center. If they live over, in Spokane, it may not be best, but then we can talk about how to find those resources in other places. So I just wanted to put that out there. And then I see there's something about neurology. I think that might explain. Yeah. Wow. There's lots of excellent questions. We've got 2 more minutes. Oh yeah, it's elaborate plans for parking lot anesthesia inductions. Right? There's lots of. Let's see here. Creativity is key. Oh, good. Sydney, put your email in there too. Oh, dentists. I did want to give a shout out. Yes. Thank you, Carrie, for putting about the Center for Pediatric Dentistry. I'd also say on our Seattle Children's Autism Center website for patient and family education, there's a whole section on dentists. And we have several patient education flyers on there, including social stories about dentists, including like there's these databases you can go in and you put in your insurance and where you live, and it shows you what dentists in that area are pediatric dentists. And anyways, there's lots of great resources on there as well too about dentists. Yes, great. I wanted to leave this last minute for Sydney to see if there was anything else, because I have the gift of the gab and I could fill this space up and talk all of your ears off. But Sydney, was there anything else, the last parting words you'd like to give?
Just that when you go to see a dentist, just let your dentist know ahead of time that the person has autism, because they might be scared and confused about why they're at the dentist and to get their, well, for 2 reasons. 1 is to get your teeth clean, and 2 is to make sure your teeth are healthy.
Excellent. I agree, Sydney. We need to communicate with our kids and make sure they know what's going on. Excellent. All right. Well, thank you guys very much for your time. Mindy, was there anything else? Or I guess you guys are moving to your next speaker.
Yes, I again appreciate both of you for joining us today, and your presentation was fabulous. And again, I have taken down as many of the questions and asked for resources, and then I will again combine that to the master list and send it all out to everybody probably sometime next week. after I get some clarification on answers. But again, thank you so much. And Sydney, it was a pleasure to have you join us as well.